Hi everyone, I am Dr. Prashant working as assistant professor in Public Health Dentistry in Government Dental College. Today I will be discussing on the topic of Caries activity test. This is very important for Public Health Dentistry exam. So my contents will be introductions, definitions, Caries activity test, karyogram, prevention of dental caries, conclusion and references. So introductions. What is dental caries? Dental caries is a biosocial disease that can be prevented if certain risk factors could be identified in susceptible individuals or community. Caries lesions are detected by a clinical examination coupled with biting radiograph, but a clinical examination neither predicts caries activity nor indicates patient susceptibility to dental caries. So, a simple, reliable laboratory test that could be do this would greatly facilitate the clinical management of patients. Now let's see the definitions which is related to the caries activity test. What is caries activity? It refers to increment of active lesions over stated period of time. It means one particular time how much increment of caries lesion is active is considered as caries activity. Next, what is caries susceptibility? Caries susceptibility is susceptibility of tooth to caries producing environment. Next, we will be seeing the risk is defined as the probability that some harmful event will occur. So now let's see what is the objectives of caries activity test. It's identify parameters associated with the caries process. It indicates the extent of challenges, indicator of repair capability or defect of the tooth. It estimate the probability of caries. So now next we'll be seeing the uses of caries activity test. So first is identify high risk group and individual. So by doing the caries activity test, we can find out high risk group or individuals. It also determines the need of personalized preventive measures and motivate the individual. Monitor the effectiveness of oral health education program by establishing an initial base level of cariogenic pathogen. Ensure a low level caries activity before starting any extensive restorative procedure. So also can act as a serve as an index of the success of therapeutic measures. So some tests which measure the caries susceptibility are like Lactobacillus colony test, S mutants level in saliva, deep slide method for S mutants count, Albans test, Swab test, saliva buffer capacity. Some tests which measure caries activity like enamel solubility test, Dewar test, salivary test. So we'll be seeing few important tests which is important for exams and which will be now we'll be seeing few important caries activity test. First test is Lactobacillus colony count test. It was introduced by Hadley in 1933. Let's see what is the procedure. Immediately after rinsing the patient, chew a small piece of paraffin. The saliva that accumulates in the plug samples in some 3 minutes is collected in a sterile container. The saliva collected in diluted 1:10 and 1:100 dilution with sterile saline solution. Then 0.4 ml of each dilution is spread on the surface of agar plate containing 20 ml of cooled liquidified agar, which also called as Rosaga agar plate. And the plates are incubated for 3 to 4 days at 37 degrees Celsius. Now we'll see how we'll be interpreting. So if the colony count is 0 to 1000, will be considered as a little or non-caries activity. If it is 1000 to 5000, we consider as a slight activity. If it is 5000 to 10,000, we consider as a moderate activity, and more than 10,000, consider as a marked caries activity. This test has some advantage and disadvantage also. Advantage are it's simple, useful for any screening purpose, and disadvantage is the result take longer duration, and colony count is it is tedious. Next, we'll be seeing the swab test. It was introduced by Grainger et al. In 1965. In this, no collection of saliva is necessary. The oral flora is sampled by swabbing the buccal surface of the teeth with a cotton applicator, which is subsequently incubated in the medium. The change in pH following a 48 hours incubation is read on pH meter, or color changes is read by the color comparator. So the interpretation of this test, if pH 4.1 or less than 4.1, it considered as a marked Caries activity. If pH is 4.2 to 4.4, it's considered as an active Caries activity. If pH is 4.5 to 4.6, considered as a slightly active, and if pH 4.6 and over, considered as a Caries active. So now Snyder test. It was introduced by Snyder in 1951. So this called as calorimetric Snyder test. In this, measure the rapidity of acid formation when a sample is of stimulated saliva is inoculated into the glucose agar, adjusted to pH 4.7 to 5, and with bromocassol green as a color indicator. This is very important MCQ, that in Snyder test, which indicator used? It is named as bromocassol green. In this, paraffin stimulated saliva is collected before breakfast. 0.2 ml is pipetted into the tube agar and maintained at 50 degrees